live, but now I don't. There it is. Meeting is now live streaming on Facebook.
All right, all right, all right. Hi, everybody. Let me just look on my phone here and see if I can see, and we'll have all of you send us a little thumbs up or a note that you do see us. I'm not seeing it yet on my phone. Let me go back out and here and go to the VBF page. That's how I know. Yep, there we are. Awesome, awesome. So if you keep your cell phone next to you, you can also use it to see the questions on it as they come through. But it's okay. So I can see that there are people. Hi, everybody that's logging on. Let us know. Everyone that joins us, and I'll get into introductions. Let us know where you're calling from and what country, what state, and then what your question is for Dr. Nelson. So welcome to the August 2024 VBF Facebook Live. It's our 30th anniversary this year. Can you believe it, Dr. Nelson? It's been 30 years.
No, I cannot. Well, I wasn't involved in all 30 of them. I've been involved in about 25 of them. So I wasn't there at the beginning.
Yeah, you met me in 2000-ish in New York City at Roy's meeting, and you said, I want one of these in California.
That's true.
And
that statement is true.
Yep. So that was almost 25 years ago. Okay. So we have a lot of you on. So Dr. Nelson is the director of the Beckman Laser Institute, a pioneer in treating vascular birthmarks with lasers. He invented the dynamic cooling device, which has been the only invention that's brought any comfort to any patients who've had laser in the past and described the treatments as torture. So the cooling device definitely has improved that for everyone. We also have some exciting news we'll be talking about throughout this hour about the new laser, what we're going to have at the super clinic to try out. I don't know about you, Dr. Nelson, but I am so excited to see that new laser and that we're going to be the first ones to premiere it in October in New York City. Is very exciting.
Well, it's exciting that the device is coming out. The question is, I think we need to, basically it's replacing the Prima, which was a device that had a lot of technical issues. I think we need to be fair until we actually test it. Is this really going to be, a device which is going to improve therapeutic outcome? Yellow light is yellow light. My understanding is the spot sizes are going to be the same, the repetition rate, the cooling and all of that. The question is, hopefully it's going to solve all of the technical issues, which resulted in a lot of downtime for a lot of the lasers. So,
but also it's a 15 size spot size. And for those who've had laser back in the old 5 mil, and even the 7 on the children, Dr. G's talking about the 15 spot size on the kids with the newer settings, really is going to cut their treatments down to in half, like how many treatments they'll need with this new device.
Well, the Prima, when it's functioning, will go to 15 millimeters, as I said, when it's functioning. So we'll see.
Well, I'm cautiously optimistic, and
so am I. So am I.
And so I know there's been a lot of people are on, so you can all ask your questions. I'm not seeing any. Oh, yeah, wait a minute. I'm seeing some now. Michelle Young and 8 others are watching. Joanna from Kentucky. Kristen, hello from New Zealand. Hello, Kiana from Trinidad. Hi, everybody that's on right now. We can take hello from Canada. We can take your questions, all things laser and combination laser drug therapies. I don't know if you know this, Dr. Nelson, but I'm working on a study right now with Dr. Cohen on ulcerated hemangiomas. Is the beta blocker actually making it worse? And we're collecting a lot of data on that now. So you may be hearing some information or getting a survey on that as well. So I know you will do early laser treatment and maybe topical timolol, correct, as one of your first lines?
Yeah, topical. We do the laser. We do the topical timolol. And we also do the oral propranolol. But there's been a lot of statements and misinformation about the laser causing breakdown and ulceration. I have never seen that in more than 35 years of doing this. I have never seen a laser cause a hemangioma to ulcerate. The hemangiomas I've seen ulcerate, and in fact, I saw a young child last week where their pediatrician is sitting there watching hemangioma on the temple and the ear, not starting the child on propranolol, and now it's ulcerating. So, it's the laser does not cause ulceration. The pulse dye laser can actually be very useful to stimulate granulation tissue and stimulate the healing process. So there, the laser has a role after the ulceration has occurred, but the laser itself does not cause ulceration of hemangiomas.
And I agree with that. However, there can be some user error with that laser with treating those ulcers. So you got to know how to really use it, like an expert like you or Dr. G or Dr. Tanous, who knows how to, when you're treating an ulcerated lesion, aren't you very gentle with the
Yes.
settings?
Yes,
Yeah.
we use very low settings, almost like what we do for scars, which are metabolically active, where your goal is not to be aggressive. What you want to do is calm things down. So typically when I'm doing those treatments, I'm using like 4.5, 5 joules, which is, about half what we normally use for a port wine stain treatment. Very short pulses, just trying to stimulate the formation of granulation tissue. And in fact, if you do that, it actually works very, very well.
So we have hello from Florida, hello from London. Hello, everybody. We can take your questions. And also, while we're waiting for some of the questions to come in, I'm still getting a lot of questions and inquiries about the photodynamic therapy. What I've been telling everybody is at this point, we're not really ready to endorse it because we haven't really seen enough evidence of its outcomes. I don't know. Do you have another way of explaining it?
Well, the company is beginning a study in the United States, and they've got several centers that are going to be participating. At least initially, they're confining the port wine stain sites to initially the posterior neck, which is a very difficult anatomic location to find suitable subjects. But as you suggested, there hasn't been enough clinical data to support whether or not this will be helpful in terms of the treatment of port wine stains in general and in infants and young children, in particular. I think I shared with you an example of a child that I treated with pulse dye laser treatment many years ago. The family returned to Shanghai, I think it was, and had a laser treatment with PDT, and the mother sent me a photograph of an ulceration. So, the problem with the PDT is that the photosensitizer not only goes into the venules, which is what port wine stains are, it also goes into the arterioles. So you have the potential to infarct the blood supply to the normal skin when you're doing this. And so it's a very tricky proposition. My R.E.A. Ornstein and I actually initially talked about this in 1988 to show what a dinosaur I am. We actually published a paper that far old, suggesting the possibility of doing this. But because of the risk of tissue necrosis, because the sensitizer is also in the arteriole, that's the challenge that needs to be overcome.
So we have a question from Ashley from Burlington, Ontario. She said, our little guy gets pulse dye laser every few months. How often is best to treat it? And is this the best laser to use? Or we've just been told about the Candela G Max Pro Alexandrite laser.
All right, well, the G Max Pro Alexandrite laser is a combined Alexandrite and diag laser. That was primarily developed for laser-assisted hair removal. So unless this is a nodular hypertrophic lesion, no, that child should not be treated with that laser that you just mentioned, that Alexandrite YAG. No, the pulse dye laser is the standard of care for infants and young children. Here in Irvine, we're treating kids very, very aggressively. In fact, today I did a 6-week-old, the third treatment. We're doing the aggressive. The child is out of state. So otherwise, we've actually got a few kids now where we're treating them every week to see how well they do. infants and young children. We'll treat them as aggressively as we can every 1 to 2 weeks. And then we just go with that until we can get the maximum clearance. And I think that there's no question that if you're aggressive initially in infants and young children, you can attain maximum clearance. Yes, you may need some maintenance treatment. Yes, there may be some reperfusion and reformation of the port wine stain, particularly when children go through growth spurts where their hormonal status changes. But there's no question that you want to be as aggressive as possible with infants and young children.
I'm so excited to hear you're doing the weekly like Dr. G, and he's seeing patients cleared or reaching their potential maximum clearance, the individuals before age 5 months, because he's doing it weekly or biweekly. So the ones that you've done your third one today, and the baby's only 6 weeks, are you seeing a dramatic amount of clearance?
Yeah, there's no question the port wine stain is dramatically lighter. Particularly, the lesion is actually a V1 dermatoma lesion, so I'm not treating the scalp. So I actually have a control, so you can see right at the hairline what the difference is between the laser, the area that's been exposed to the laser, and that which has not been treated. And there's no question this child has responded very, very well. The family is very, very happy, and we're going to continue this aggressively every 2 weeks.
Awesome. So we have a question from Mary Frenette. She says she's 72, and is there any point in me getting another laser? It's been at least 10 years. It is very painful for me.
Well, I don't have a picture of Mary in front of me. Pain is generally, not an issue, it's particularly now with the topical anesthetics like EMLA, Prilocaine, 7% xylocaine, regional nerve blocks, depending on where exactly it is. I mean, these procedures should not be painful. I mean, when we've done the clinics here in Irvine, we've put in regional blocks. Patients have tolerated those very well. The question is, where is Mary's port wine stain? Is she developing the nodularity, the hypertrophy? If she is using the longer wavelength of the Prima, the ND-YAG, which will penetrate deeper, that's wonderful for flattening and smoothing out the nodularity. And in fact, I think at the last conference in Irvine, I think I gave you for the cover of the program, a woman she's a retired nurse, oncology nurse at UCLA. And we did like 10 treatments on her. And essentially, I mean, she's probably achieved 90% fading of her port wine stain. So
right,
now
and she hadn't started till her late 40s.
Yes. In fact, you look back on your
I remember
conference proceedings, and in fact, I still show her picture. In fact, there's going to be a laser conference that's in Boston the first week of November, and we're being asked to turn in our slides already for this conference at Harvard. And I've already got her slide out. I mean, if I could share my screen, I could actually show the pictures.
Wow, that's awesome. Okay, so Braca Zelgler says, hello, I hope all is well. My son is 3.5 months old with a facial port wine, right eyelid, forehead, and scalp. I was curious about laser on the eyebrow and scalp. Will it affect the hair growth? Also, he just developed eczema. Is there any correlation of the eczema and the stain?
Well, to answer the first question first, we generally don't treat into the hairline because we know patients can develop alopecia. That if you the hair follicles contain melanin, which is what gives you the color of your hair. So when you're doing these procedures with yellow light, the melanocytes in the hair follicles are going to absorb the laser light. Therefore, you're going to damage them with these millisecond domain lasers. So I try and stay away from the hairline. In terms of the eyebrow, I try and get as close to it as I can. We put, Lubriderm on it. We try, soaking it, wetting it, but still you can get a little bit of hair loss because the yellow light is going to be absorbed by those melanocytes in the hair follicles. In terms of eczema, I don't know whether this has actually been published, but sort of when we talk at academic symposia, I think most practitioners who are doing a lot of laser treatments will tell you about a third of kids will develop eczema on their port wine stain. And we see that very commonly. We start low. We tell patients or families, use cool compresses, avoid soaps, detergents, things like that, when they're washing, so their clothes don't, get the soaps, cool compresses. Next step, if that isn't helpful, you can actually go to like 1% over the counter hydrocortisone. That can be helpful. If that still doesn't help, you can bump that up to 2.5% hydrocortisone. That requires a prescription in California. What I found to work actually very well is hydrocortisone butyrate. The problem is that a lot of insurance companies won't cover hydrocortisone butyrate. And unfortunately, I've got a few kids who've just got bad ectopic dermatitis and eczema who we've actually got on tacrolimus. But that's the number of those patients I can count on one hand. Most people, cool compresses, avoid soaps, avoid detergents, a mild topical steroid, usually will calm down the eczema. One of the few advantages of growing older is that the eczema will get better. I am not going to get eczema because I'm so old.
That was a great answer. And by the way, I'm doing a research study with a medical student right now, collecting data on port wine stains and this eczema phenomenon, this epiphenomenon that's been occurring. So maybe we'll get some information out of it.
Sure. I mean, I can tell you, we have lots of patients who have eczema. It's a problem because, in fact, some of the email I get through your website, people will say, well, my child had a port wine stain laser treatment a month ago, and now the port wine stain looks to me like it's worse. The laser has made it worse. I mean, you can certainly develop eczema as a result, as just because of the port wine stain, but also, particularly when you're doing these treatments frequently. Yes, that was very kind of you to make your remarks about the dynamic cooling device. It does cool the upper layer of the skin, but the melanin still absorbs the laser light. And because it absorbs the laser light, the melanocytes can be activated and you can get transient pigmentary changes in the skin as well. So a lot of this can happen after the laser treatment's done. I mean, we love to talk about how selective the laser treatment is, but unfortunately, the melanin in the upper layer of the skin acts as an optical barrier that no matter, even though the D's there to protect scabbing and blistering, those melanocytes are still going to be activated.
Good, great answer. Ashley, I can respond to you. She was the one that talked about having the treatments every couple months, and she's likely heading into maintenance. Every patient's maintenance is different. It's whenever it starts to reappear after you reach maximum clearance is usually the maintenance schedule. That's what we found. Some people went 18 months before they saw any of it come back. Some went years, some went a month. And you can't say what a maintenance schedule is going to be. You just have to get maximum clearance. And when two or more treatments don't result in further clearance, then you need to go into maintenance and wait until it flares up again and then hit it again. I mean, do you have anything different to add when
we know that these are progressive lesions. I mean, the work that we did, with Wen Bintan, who was my former fellow, who's now in South Carolina, with unfortunately Dr. Martin Mim, who passed away, we did a lot of histological studies on biopsies of infants and young children. And these are progressive lesions. There are enzymatic pathways which are activated in these port wine stains, which are going to cause the lesions to continue to grow. So it's not unexpected that because of that predilection, you can get some recurrence and redarkening. Where we see it the most is where hormonal changes. When kids go through a growth spurt, everything's calmed down, everything's great. And then all of a sudden, the kid goes into the 7th grade and they grow 6 inches in 6 months. All of a sudden, the port wine stain has come back, it's darker. And so, what I'll tell the family is, look, we need to do 2 or 3 laser treatments that are closer together, and then you can get them back to where they were. And then there are other hormonal issues, pregnancy, menopause. Patients will tell you when they're pregnant, my port wine stain got a lot worse, when I got pregnant with my child.
Thank you. So Johnny wants to know, or Jonna wants to know, for the lasers, are they only good for port wine, or can they help venous malformations or lymphatics as well?
They certainly can help venous malformations. In fact, I actually see quite a few patients with venous malformations. I saw a patient today. I think I've got 2 treatments on my schedule later this week. But when you're talking about venous malformations, they're underneath the skin. They're much deeper than port wine stains. And so when you're going to be treating venous malformations with laser, you're not going to be using the yellow light pulse dye laser wavelength. You need to get that light deeper into the skin. And so that's the one big advantage of the Prima laser when it's working, is that it also has an ND-YAG laser wavelength in the device so that you can treat these venous malformations. And it actually works very, very well. So yes, you can treat venous malformations, but not with yellow light. You need to use the more deeply penetrating infrared light. I have not been as thrilled with our results with lymphatic malformations using lasers. Most of the ones I see are deeper underneath the skin, and I refer them to my interventional radiology colleagues. My former colleague, Kari Nelson, who is now at the University of Utah, we did a study of the cutaneous component of lymphatic malformations, people who get these sort of vesicular lesions on the surface of the skin. And we actually did a study of taldenafil and sildenafil. These drugs are phosphodiesterase inhibitors. Yes, they're used to treat erectile dysfunction, but there was a study that was done at Stanford which showed that they can reduce lymphatic malformations. And we actually found and published a paper that showed using those phosphodiesterase inhibitors, it can cut down the superficial component of the lymphatic malformation dramatically. So that's my approach now. Interventional radiology to the deep lesions, phosphodiesterase inhibitors for the cutaneous component of lymphatic malformations.
Thank you. This next question, I haven't had a chance to talk to you about this yet, Dr. Nelson, but I've been in communication with Dr. Geronimus to participate in a study while, and this Mike is an answer to your question, Mike Gallick, whose daughter has a treatment resistant port wine. She was going every 2 weeks, and everybody's just shocked at the lack of progress. So what happened is when we had our ultrasound clinic in Darien, Connecticut, we had so many port wine stain cases, and Dr. Nasseri started noticing, Dr. Nelson, that sub to the capillary involvement were engorged venules that appeared to be exchanging, information between the capillary and the venules. So he actually mapped 4 venules and wants to try a very ultra microscopic scleral therapy on these and then send them back to Roy for lasering. So this is something that Roy said he's actually been thinking about this, which is with the treatment resistant ones, let's map them, let's get ultrasound, let's see if the venules are engorged, and then go after them with this type of scleral therapy, micro, very tiny needle, and then see if in fact that will enable the laser to reach the stain. I don't know, what do you think about that?
Well, I mean, you're talking about ultrasound. I mean, to
Right.
me, the resolution of ultrasound is somewhat limited. I mean, the question I would have, when you see these sort of types of lesions, is there an arterial component to this? I mean, when I see these resistant lesions, they just don't work. I am more likely to order a magnetic resonance angiogram of the study to lesion and then let the radiologist watch in real time the dye go into the vascular malformation, it circulate and then come out. I mean, but there's no doubt, even if the radiologist says there's no, AVM there, there's no question that some of these lesions are very, very high flow. And you just can't get enough heat generated within that, millisecond that you're exposing it to heat those vessels up. So, I mean, what you're talking about makes sense to me. The question is, are they going to do this under guided ultrasound to make
Yeah.
sure they're in these venules?
Yes, and his new duplex ultrasound is extreme high resolution, like sees the capillaries, the lymphatics, the venules. He's got a clear shot at it. We're going to try a couple adults that have treatment resistant to see if that prep and then send them back to Roy will make a difference.
Is he coming to New York? Will he be there
Yeah,
at the conference on,
yeah,
what is it,
yeah.
October
Yep,
5th?
yep. He'll be there on Friday with Dr. Coletti at the ultrasound clinic all day, and then he'll be there all day Saturday
Okay.
seeing patients. So you'll get to see him.
I'd like to talk to him.
Okay, so Cethi says my son's right side where the Port Weinstein area is slightly larger. Can we do anything to bring it back to normal size?
Well, I mean, I don't have a photograph. I mean, certainly, yes. I mean, it's not unusual for some patients to develop, nodularity or, some soft tissue hypertrophy because the blood flow to that particular area of the face is larger and higher and persistent. So, I mean, the most common place we see it are on the upper or lower lips. And my facial plastic colleagues can do a lip reduction, as an outpatient procedure, and an outpatient OSS can even be done with sedation. Patient doesn't necessarily need a general anesthetic, but certainly, the lip component can easily be reduced by a plastic surgeon with a bulk reduction. Yes.
Unless she's talking about extremities being enlarged, and then it has
Well,
to be worked up for KTS.
Well, then, yeah, exactly. That patient needs a workup for Klippel-Trenaunay syndrome. They possibly need, genetic testing for PIK3CA to see if they have that malformation. I mean, the right side, maybe I just didn't hear it. Right side of what? Did she say face or
No,
extremity or?
she just said, hi, my son's right side where the Port Weinstein area is slightly big. Can we do anything to bring to normal? She's from Singapore, so she's doing the best she can. She'll circle back. But
Well,
let me just,
there's very good physicians in Singapore that could certainly do this at the Women and Children's Hospital in Singapore. I know we can refer them to, since I've given lectures in Singapore. Let's see.
is that where Dr. Chan is?
No, Henry is in Hong Kong.
Okay.
Okay, not Dr. Mark Koh, Koh, is head of the pediatric dermatology department at the KK Women's and Children's Hospital in Singapore. So Dr. Mark Koh at the KK Women's and Children's Hospital in Singapore, who I have met and is eminently well qualified to do this.
All right, well, I've got a great question from Vin Ragucci. He wants to know if there's any known side effects of drinking alcohol if you have a port wine stain as an adult.
Not to my knowledge. I mean, people are born with port wine stains. They're not an acquired lesion. So no, I do not. Please feel free to have, a nice cocktail with dinner and not be concerned about this.
Okay, Kirsty Heather says she's 52, she's in New Zealand, and started her journey with an argon laser in Sydney, QT12. I don't know what that means. Luckily, no scarring. I've had treatment over the past 30 years with the break while having kids. For me, it's like a health check, and I have treatment once every 6 months to keep my skin smooth. Makes a massive difference. My latest healing cream is emu oil, and it's so gentle. I think it's important to keep it up. It still fades each time. Great info, guys. So, I mean, she's 52 and 30 years ago had the old argon. I feel her pain.
Well, so is she still doing laser? Is she asking for a referral in New Zealand to do continued laser treatment? I mean, what I could do would be to give her the name of Dr. Paul Legrice, who is in Auckland, who's again somebody who I've met at academic symposia. Legrice is spelled Legrice. So I know he has access to pulse dye laser technology. So if she's interested in, nobody's going to be doing argon laser anymore. I mean, that went out in the 1990s. I mean, we're going back to way before even the PDLs were developed. So I know that PDL technology is available in New Zealand, and I would refer her to Dr. Paul Legrice in Auckland.
Thank you for that. Dan Lendini says he needs to reduce his lower lip. He's 76 years old. Can I get this done without laser? And what kind of a doctor do I need to see?
Well, first of all, if he's got extensive lower lip hypertrophy, he can do it without a laser because the laser's not going to help. I mean, I thought that's the way you, maybe I misunderstood the way you read the laser is not going to help with extensive soft tissue hypertrophy. He should be referred to a facial plastic surgeon, particularly somebody who has experience in dealing, with malformations, of the lower lip. But
And
it can
also,
certainly be done. It can
and
certainly be done.
this is another new technique that Dr. Nasseri is doing where he's using this detergent, I guess he called it, to sclerose the lower lip. And he's getting a lot of, when it's first starting to enlarge, and he's getting it to shrink back down and to stay down. So if he catches it early with this new sclerosant, he's going right into the vessels and he's getting a phenomenal result. So that
Well,
may
a lot
be
of times if we realize it in the kids, remember I talked about the deeper Nd:YAG laser wavelength. You do not want to be, somebody asked a question about, I don't remember, it was about the GentleMax G Pro or something, which is the
right.
combined alexandrite. Do not do that on the skin. Okay, but it would be certainly reasonable to take an Nd:YAG laser and go across like the lower lip, stay away from the vermilion border. When I see this, I'll evert the lip. I'll have my nurse Chloe evert the lip, and then on the inside of the lip, you can go along and use that deeper penetrating Nd:YAG laser and shrink and tighten some of that hypertrophy. Now, that laser is going to cause some sloughing. So people are going to be a little bit uncomfortable for about a week, if they've got a history of HSV, herpes simplex, they need to be prophylaxed for a couple of days before you do that. They're going to do some warm water mouth rinse saline every hour, for a couple of days, or maybe even a week or so. It's a little bit uncomfortable, a little bit painful, but yes, you can actually do that with the laser if you catch it early enough.
Great. So Seema is writing to us from the UK. I'm shocked to hear she has a 10-month-old daughter that's had 9 PDL treatments, because it's pretty hard to find anyone that treats a baby in the UK. So good job to you, Mom, Seema. She said, if you have reached maximum clearance, we've seen about 60% with the stubborn cheek area, and no further significant changes despite changing settings, is it worth it still to getting prophylactic PDL instead of taking a long break to minimize progression? Hypothetically, if you take a long break and then treat, are you likely to get the same clearance as we achieved within his first year?
I would recommend a maintenance treatment for a child this age, but by maintenance, I would not, as you and I were talking about, waiting for it to come back. I would adopt a maintenance treatment that was going to be like, 3, maybe 4 treatments a year to maintain that result, the good result that they've achieved. I mean, in a 3.5-year-old, I have grandchildren that age. They're good. That growth spurt is going to come. It's just a matter of time. So I would recommend that they continue with the laser treatment, every 3 to 4 months. And I hope they'll come to the laser clinic that you're having in London on I think it's March 22nd, I think was the day you converged on. There's a lot of patients. I get a lot of email through your website, people in the UK, and I'm telling them to contact you so that they can be seen at that clinic next March.
Yeah, I'm excited about that. Finally, after 25 years, we're going to the UK. Natia says, I've done 8 laser treatments with the pulse dye laser for my son. Also, he has glaucoma and pressure changes. I am interested in any connection between laser and eye pressure. Like she's worried about, can the laser affect the glaucoma of the eye?
Well, first of all, we want to make sure that child has got a shield in their eye, and so that the laser's not going to damage the eye. But there was actually a very controversial paper that was published probably 15 or 20 years ago. It was published by an ophthalmologist at Johns Hopkins, and I have to admit that I cannot remember the man's name, but he actually argued and showed that if the port wine stain involves the upper and lower eyelids, and the patient has glaucoma, if you treat those areas around the orbit, it will actually reduce the intraocular pressure. Now, I don't have any other data to back that up. I'm not an ophthalmologist, but that was one case study that came out of Johns Hopkins, which suggested the benefit of treating the periocular area, including the upper or lower eyelids, as a means to help treat the glaucoma. It blocks the shunting of the blood into the eye, which is increasing the intraocular pressure.
Dr. Comey would know who that was. She was probably on the paper because she's the Hopkins Sturge-Weber syndrome expert.
Yeah, it came out, it was an ophthalmologist at Hopkins. I just can't remember. I think I met him actually at one conference, but unfortunately, I think I remember the names of LeGrice and Mark Coe in Singapore, but this one I can't remember. I'd have to look.
So Kirsty is saying she's had the argon since 12 with Sweet Tan. I remember Dr. Sweet Tan. You remember Sweet Tan?
You mean Tan?
Well, Sweet, S-W-E-E, yes, Tan.
Well, her name was Tot Tan. I don't know who Sweet Tan is.
No, Sweet Tan is from New Zealand.
Oh, okay. I did not know that. Okay.
Yeah.
Dr. Tan to me means the woman who was in Boston, who was
No.
at Harvard. That's who. I'm sorry. Okay.
And Sweet Tan's been involved with VBF for years, like 30 years. Oh, Sydney. I'm sorry. It was not New Zealand. You're right, Kiana. It's Sydney, Australia, where Sweet Tan is. You're right. Okay, Sithi says, Dr. Linda, can I have a Zoom session with Dr. Nelson? I can show my son's face. We are willing to come to the US. Well, Sithi, go on our website at birthmark.org and scroll down and you'll see we have the free clinic in October. Everybody heads up, October.
That's where she should come to. Unfortunately, the University of California will not allow us to do telemedicine consults out of state. And I don't know why that is, but we cannot do a telemedicine consult with somebody who was outside the state of California, let alone outside the United States. But if she's willing to travel,
yes,
I will be there on October 5th.
October 4th and 5th. And on the 4th, we're having the Sturge-Weber assessments with Dr. Comey at Dr. G's. Then on Saturday is the free laser and all the other free glaucoma and all of that. And you'll
Well, I'd
see
be happy to talk to the family on that Saturday, the 5th.
yeah.
Be happy to.
So go to birthmark.org, scroll down to where you see the New York conference, October 4th and 5th, and hurry up before the free hotel rooms disappear because we don't have a lot left because we have a massive, massive clinic already. Tom Davies says, great information. Thank you so much. Do you know anyone in Ontario you could recommend for laser?
Well, yes, I can. One of my former fellows, Dr. Corliss Best, is at the Eastern Ontario University School of Medicine in Ottawa. Corliss is setting up a practice. She was with me for a year. She's excellent. She got a ridiculously high score on the facial plastic boards. So look up Dr. Corliss, Corlissbest, Corliss Best.
We need to get her info to add to our website for all the people that live there.
I
So
think if you just Google her, one of the residents, we had the new fellows just started, a month ago. So we always catch up with the old fellows. And so we actually Googled her website. It's beautiful. It's it's
well,
it's it's absolutely beautiful. So just Google Dr. Corliss Best, Ottawa. You'll find her. Trust me.
I know, but we need somebody from her practice to submit her headshot, her bio, all the info to get.
Her pictures are beautiful.
Yes,
They're
I know. I've seen.
unbelievable website. Unbelievable website.
Okay, so Shauna, okay, so we have been using the 10 millimeter probe with variation in pulse width length for my 10-month-old port wine. After multiple treatments, there's no improvement. Is it worth trying the 7 millimeter probe? It was explained to us, hope I understood, that a 7 millimeter, you are limited to a max energy and that it doesn't make sense to use it versus a 10 millimeter one to cover a larger area.
Well, I think I'm not sure that actually came out right. I mean, you always want to use the largest spot size you can. And the reason is that when light goes into human skin, it scatters. Okay. So not only does it scatter out of the beam, it scatters into the center of the beam. So when you're using a larger spot size, you get a higher energy density deeper in the skin. So when I'm talking to the residents and the fellows, always use the largest spot size you can. Now, you can certainly go to a smaller spot. You'll be able to get a higher energy density. But when you focus that laser beam on smaller spots, particularly with higher energy densities, you're at risk of scarring. That is almost a recipe for getting a well demarcated circular depressed scar. We have the 7 millimeter spot size. I use it for telangiectasia and as cosmetic treatments in patients, but almost routinely I use a 12 millimeter spot size. Always the largest spot size you can. It's been, as I said, it's just a basic principle of physics. Rayleigh scattering. The larger the spot, the more effective and higher energy density deeper into the skin. So no, I would not use a 7 millimeter spot.
Okay. Shauna wants to know, she's a 52-year-old female and has never received treatment for her hemangioma vascular malformation. It's on her neck and right ear. She's been told it's thickening to the point it's causing auditory nerve damage. Her ENT has no recommendations. What type of doctor should I see? I don't know where you are, Shauna, but if you came to our free super clinic in October in New York City, you could see Dr. Levitin and Dr. Darrow, who are two ENTs that specialize in vascular anomalies. So that's what you should be looking for, is a vascular anomaly expert ENT. They'll be able to check that. Is there anything you want to add to that, Dr.
Well,
Nelson?
she said hemangioma vascular malformation. I
I
mean, the
know.
woman is 52. So, the first thing that pops into my mind is hemangiomas are tumors of infants and young children. She does
Right.
not have a hemangioma. So the question is, does this woman have purely a port wine stain capillary vascular malformation, or does this woman have a venous malformation or something else? So your
Right.
recommendation, she needs to be seen by a specialist who can make, number one, an accurate diagnosis, and then number two, come up with a conscientiously and intelligently planned approach to her treatment.
True. Okay, well, I was just saying, if she came to our free clinic, there are
Yes.
ENTs there, so. Angel Perez Flores, her 7-year-old daughter underwent 5 years treatment for facial hemangioma and venous malformation. No more bulk, but still have slight redness from her face and ear. Our doctor stopped the meds when she was 5 and told us just wait for it to remove normally. We are from the Philippines. Again, mixing hemangiomas with venous
Yeah.
malformation. So,
Well, I think it's entirely probable that this is a hemangioma. What it sounds to me is like the hemangioma grew aggressively. She was treated with propranolol, and probably, if I had to guess, she's got some residual telangiectatic matting. And by that I mean patients who have a hemangioma of the face, when it's all calmed down, it's flattened, it's smoothened out, they have this whole network of blood vessels in the area of the hemangioma. We call it telangiectatic matting. That is very easily treated by pulse dye laser. 2 or 3 treatments that should resolve spontaneously. That's the easiest thing to treat. I would have my fellow do it, and I would sit, and let them trace out the individual vessels. It's a very easy treatment to do.
Thank you. McCall Starborough wants to know, what direction do you think port wine stain treatment will continue to go in terms of scientific development?
Well, I think the main area of scientific development now is that we're looking at more and more genetic markers. We're taking more and more biopsies, trying to understand what metabolic pathways are activated in these infants and young children. As I said, I spoke earlier about the work that we did with Dr. Wen Bintan and with Marty Mim. There is no doubt that a variety of enzymatic pathways, particularly the MAP kinase pathways, are very active in these port wine stain birthmarks. So the question is, if we can understand, and each one of these pathways is not just one pathway, they all come together. I once asked Marty Mim, how many enzymatic pathways are there in human skin? He said over 1,000. So, I mean, there's so many of these pathways. We need to understand which ones are involved. And then, of course, the holy grail would be, what kind of therapeutic intervention, can we do to block these enzymatic pathways that will block the proliferation, that will block the recurrence of these vascular birthmarks after we do the laser treatment. That's where I think ultimately the big advances are going to be made.
Thank you for that. 13 minutes to go. It's been going very fast. So Suzanne says she's 64, her blebs have returned, but they don't break. Would getting laser treatment be considered medically necessary when I start Medicare this December?
Well, Medicare is a very, very difficult entity to deal with. A lot of the laser procedures they don't cover. I would tell this woman, go see somebody immediately and get those laser blebs treated. Flattening and smoothing out the blebs with the ND-YAG laser, again, the more deeply penetrating infrared device, is an easy procedure to do. You literally go around and tap on those individual blebs, and with 1 or 2 treatments, you can flatten and smoothen them all out. A lot of Medicare doesn't cover a lot of these procedures. And in fact, I can't see Medicare patients because I treat kids. You have to treat a certain number of Medicare patients a year or Medicare drops you. And because I treat primarily infants and young children, I'm not even a Medicare provider. Now, I'm sure there are people others in the US who are doing laser treatment who are, but I would encourage her before December, get in and get a laser treatment or 2.
Yeah, get to one of our free clinics.
ND-YAG.
And also we've worked out, negotiated some pretty reasonable cash deals with Dr. Goldberg in Arizona, Dr. Geronimus in New York, Dr. Ferris in London, and Dr. Coletti in Italy. So we've got a flat VBF fee that you can ask me about. My email's posted in here, and we can let you know what the code is for that.
Well, it depends on the size, how many areas. It's either going to be the 17106, 17107, or 17108. It just depends on the surface area that needs to be treated.
Somebody is saying, Carol Johanna is saying, please address Carol's question about reducing bulk. I'm not sure.
I suggested that if there's bulk, particularly of the upper or lower lip, the treatment is surgical. It's not laser, by a facial plastic surgeon.
Or this new interventional like a sclerotherapy may be an option too now.
I mean, I don't know enough about that to comment, but if you've told me that there's promising results that you've personally seen, I look forward to meeting this physician in New York next month.
So Linda wants to know about a consult. I don't know where Crystal River is in Florida, but there are doctors in Florida, Dr. Duarte, Dr. Jill Weibel. They see patients with vascular birthmarks. You could see if they would accept your insurance. With Dr. Duarte, we have a free clinic in Miami every February. So that'll be coming up next year. So that's all I can tell you. And you can look at our website at birthmark.org, select the state of Florida, and see who all those doctors are. Then you have to call and see if they accept your insurance. Only the ones I mentioned do. In the US, the VBF flat fee is $500 per treatment, no matter what size. And in the UK and Italy, it's 500 euros, which unfortunately Dr. Nelson cannot offer our patients. He
Hopefully
wishes
in the
he
UK,
could.
it's 500 pounds, not 500 euros,
Oh
but
yeah, sorry, I don't know. Yeah, it's the
you
equal
don't
of,
know your currency.
no, it's the equal, I forgot their pounds. It's the equal of $500. So as we're winding down, we have 8 minutes. Ashley wants to know, I'm 53 years old. I have a port wine on my nose and forehead. The spot on my nose has started to bleed. Can it become serious?
Well, these lesions are progressive, as we've talked about. But I mean, if it's bleeding, it's nodular or it's a pyogenic granuloma. I mean, again, without a photograph, I can't tell her which one of these two it is. If it's a nodule, using the deeper penetrating ND YAG laser will be effective. If it's a pyogenic granuloma, and if she looks in the mirror and she sees this very fleshy material that, is easily traumatized and easily bleeds, if it's a pyogenic granuloma, that lesion needs to be curetaged, where a dermatologist takes an instrument and literally scrapes the base to get rid of that inflammatory tissue. If you treat that with the laser, it will come back. So the first thing that needs to be done here is that we need a diagnosis. Is this just simply a nodule, or is this a pyogenic granuloma?
Thank you for that. Melissa is one of the patients we saw in Darien, Connecticut at the ultrasound clinic. There are no laser experts in Rochester or the Albany area. That's why I refer you to Dr. Geronimus in New York City as the best option. So yeah, we don't have any experts in Rochester or anywhere upstate New York that are true experts. Rita Sophia, she's 36. She's had over 30 laser treatments with the PDL during the 90s. Since 2021, I started to do modern PDL with YAG 1064, and it's working slowly. She did 18, but the upper lip and nose are tricky. My hemangioma, she calls it, which is not a hemangioma, it's her port wine. She has Sturge-Weber. When I was 21, I did surgery for the lip debulk. Is there a new laser my doctor here in Portugal should consider, or a combination?
No, I mean what's being done is entirely appropriate. The pulse dye laser for the skin cutaneous component, and any nodularity being treated with the ND-YAG laser. That's very appropriate. The nose is a very difficult area to treat, as are the upper lip. It's been well shown in the medical literature that the more central locations on the face respond less well as compared to the lateral side of the face, the forehead, areas over bony prominences. So she's just going to have to stick with it, but it sounds like she's making progress.
Does indeed. So Johanna is asking for a venous malformation. Would you consider bulk reduction on a 3-year-old? I would really want to find out first if it's really a venous malformation,
Well, we're
right?
going to assume that the diagnosis is right, but I mean, before anybody could say anything, this child needs an MRI, MRA of their head and neck, assuming it's on the head and neck. I mean,
Right.
the problem with venous malformations, and as I told you, I spoke to a family earlier today. You're looking at when you're looking at the redness or the purplish discoloration on the face, you're looking at the tip of the iceberg. It's not unusual for, say, a venous malformation of the cheek to be dissecting into the posterior pharynx it can be in the tonsils, it can be in the masseter muscle, it can be dissecting down the neck. So that child needs an MRI, MRA to determine the extent of this venous malformation. And then the treatment will be dictated from there. Is it going to be some form of surgical to be bulking? Is it going to be interventional radiology using embolization or possibly bleomycin? I mean, without having imaging studies, it's hard to say. And again, this is another patient who would really benefit coming to the multidisciplinary clinic with that MRI in hand so that she can talk to, the head and neck, interventional radiologists so that they can give her opinion. Because without that, we don't know what really treatment
And
would be.
all of you who are still on, it's birthmark.org. You can see it on the front to register for the super clinic in New York City. You'll see all these experts for free ultrasound, free dental, free laser, free psychotherapy, free screening for Sturge Weber. Nobody does this but us. And we've still got a few hotels left. One night, you get one night for free, but you've got to register soon because we're pretty booked up. We have more patients than we've ever had at this time. Oh, somebody wanted you to repeat the name of that Paul, the guy from Auckland.
Paul LeGrice, 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 Paul LeGrice, LE, large capital G RICE.
Okay,
Eminently well qualified.
Rita wants to know, if I want to get pregnant, how high is the risk, and should I see a specialist even for egg collection? How dangerous can this be? I'm not sure what you have, Rita, that you would ask this question. So, oh, she's 36 and she has laser and she has Sturge Weber.
Okay,
So,
well, I mean, sure, she's going to notice that her port wine stain is going to get darker during her laser treatment. But as the grandfather of somebody, a daughter and a family going through IVF, as far as I'm concerned, there should be no increased risk to her undergoing an IVF procedure as compared to the general population. Now, if you told me that this woman had Klippel-Trenaunay syndrome, not Sturge-Weber syndrome, there's been reports of, women getting, deep vein thrombosis and pulmonary emboli, in their extremity during pregnancy. And a lot of times those people need to be on prophylactic aspirin. But if by virtue of the fact this is a facial lesion, I don't think that there would be any increased risk to her undergoing IVF as compared to the normal general population.
thank you. That was an excellent answer. So we are wrapping up. We have less than 2 minutes, everyone. Again, if you'd like to see Dr. Nelson, he will be lasering in New York City at the New York City Free Super Clinic, along with Dr. Geronimus, Dr. Leonard Bernstein, and Dr. Goldberg. So we've got 4 top laser kings lasering in New York. We also have the free dental, the free ultrasound, free Sturge Weber, free consultation, free psychotherapy. Like I said, nobody offers what VBF does. It's at birthmark.org. The night before, Friday night, is a gala. We still have some tickets left for those of you who'd like to come and celebrate our 30 years and see all of our doctors there. It'll be the night before, so you can check that out also at birthmark.org. And by the way, all of these sessions, you can go back and watch Dr. Nelson over and over again from 2017 till now.
Just don't notice the aging and the increased gray hair.
Right. So, no, we do not use any anesthesia. These new lasers are quicker. We do some techniques to comfort the children, but there's no general anesthesia, not in London, not in Italy, not in DC. We've never done it and we've not had any problems. So again, thank you, Dr. Nelson. I look forward to seeing you in 5 weeks in New York City.
All right. Thank you for having me. It was good to be with you. And thank you to all the people who signed on and asked questions.
And
I look
remember,
forward to interacting.
And remember, it's our 30th anniversary, and we're asking everyone to donate $30. That's only $1 for every year that we've been helping people. So you can do that at birthmark.org/30. So birthmark.org/30 or birthmark.org/donate. We appreciate it so that we can continue the work of VBF into eternity and infinity. So thank you. Have a wonderful end to your summer, Dr. Nelson, and tell your lovely wife I said hello and safe travels, and we'll see you in New York.
Yeah, we're headed to Europe on Friday. We're looking forward to it.
Travels.
All right, take care.